How did I get this lady from here to what you see with lots of pigmentation to here in only a matter of 10 weeks? Stay tuned. Hi there, Dr. Davin Lim, board certified laser dermatologist. Today we'll be talking about a really common skin condition. I see about 3 or 4 cases per day, every day. It's called melasma or chloasma. It's also called a mask of pregnancy, and it's a special form of pigmentation. So this form of pigmentation has to be well respected because none of the energy devices here in this room, whether it be any of the lasers here, can treat it well, because melasma is a special form of pigmentation. You need to actually treat it with gentle lasers. One of the worst things you can do with melasma is try to treat it with one of these, which is basically an IPL or BBL. IPL, generally speaking, in 90% of cases, unless you know what you're doing, can make melasma worse. The only exception is if the melasma is epidermal. Certainly using things like erbium lasers or CO2 lasers or any of these lasers here will definitely make melasma worse. There are ways to treat it using other gentle lasers, which I'll show you shortly. So we're back in another room. So this is another laser room, and certainly melasma can be treated using a Fraxel 1927 laser. Even then, I feel that this laser is still a little bit too aggressive for melasma treatments. I dial that right back and go to a clear and brilliant, which is basically like a Fraxel, but in a special wavelength, a 1927 Premier wavelength. So I like using that. Any of the other devices such as radio frequency or even things like low-level emission devices, LED therapy and all that will make no difference at all to your melasma. Okay, so what lasers do we use? I'll show you very shortly, but let's go back to the basics of melasma. So what does melasma look like? So first of all, what is melasma and how does this differ from normal pigmentation? Well, this is melasma. You can see the distribution is somewhat uneven. So it's basically, we call it a moth-eaten appearance, and usually appears just below the eye, so it doesn't usually involve under the eye, but just below it. And you can see that, and most frequently it involves the upper lip. So there we have it on the upper lip. It's like a moustache. No one likes it, but that's melasma for you. So this is the classical pattern of melasma, and some people will also have it on the forehead. So you can see some pigmentation just on the forehead here. So that's a classic distribution of melasma. Temples as well, but it's mainly around the eye area and the lip area. So that's melasma, and this is a very, very different kind of form of pigmentation. Okay guys, look, to understand how to treat this condition, you got to understand why it happens. It's basically 3 things and 3 things only. It's genetic, so it's in your genes. It's also hormonal, and it's also UV induced. So the basis of all melasma treatments, the absolute basis and foundation is your sunscreen, right? So basically 2 types of sunscreen for melasma. One was an everyday sunscreen, and I really, really like using my favorite LRP, La Roche-Posay. Why do I like using it? Because it's cost effective, it's not very expensive, it's also nice, it's cosmetically elegant, and it's an SPF 50. Now, over the weekend, you're not going to use that, especially if you're going out to the beach. So you need to wear broad brim hats. You need to actually go in umbrellas, and you need to use a really thick sunscreen. I like using the Neutrogena Ultra Sheer because it's thick, it's water resistant, and it's cheap as well. So those are the sunscreen of choice. Now, in order to treat melasma, you've got to shut down those cells which are producing the excess pigment. You can do that by buying over-the-counter preparation, something like Superfade, which contains 2% hydroquinone. You can buy things even from Abaji, for example. It contains vitamin C. So remember all the acids to treat melasma. So you can treat it with ascorbic acid, kojic acid, azelaic acid, but all of these work as free radical scavengers. So vitamin C certainly can help, and we often add that in our compounded solutions. You can buy over-the-counter medications, for example, like Lytera. Does this work? Yes, it does, but does it work as well compared to something like hydroquinone? No, it doesn't. Neostrata just came out with a new compound for treating melasma. It's called Pigment Controller, and it contains the A, C, and E. So the A is the vitamin A, which basically acts as an exfoliant. The C and the E also acts as antioxidants, so they scavenge free radicals. So basically, can this work? Yes, it can. But in my opinion, the actual treatment of choice medically is this. It's a special compounded solution. So it's compounded for your skin type and your kind of melasma. So for example, someone has moderate to severe melasma, I like using a 5 to 6%. If someone has severe melasma, which is a little bit harder to treat and a little bit resistant, I do go up to 8, sometimes even 9%. The higher the strength of hydroquinone, the higher the chance of irritation. Can you be on hydroquinone for the rest of your life? No, you can't. So that's why it's got to be under the supervision of a dermatologist and let them guide you as to the percentage they compound. Okay, so this forms the basis of treatment, not laser, it's actually this. So if we're going to use a laser treatment, what laser would I pick for melasma? Okay guys, so we talked about different lasers and what I like using. Sure, Fraxel can treat melasma, Fraxel 1927, clear and brilliant, even safer. But my laser of choice are actually these lasers. They're called Q-switch lasers. They're the same lasers we use to treat tattoos, right? So how this laser works is actually not by shattering the pigment. So we don't want to aggravate the pigment cells. What we want to do is decrease the pigment production. And we use these lasers in a very low setting. So my favorite laser, the one which I personally use, is this. It's a picosure, which is a picosecond laser. I find it extremely effective for treating melasma, but you do need to be on hydroquinone before actually being on this. So with all this, with the actual pico, I actually do the treatment myself because it is you're skating a fine line between making melasma better and making it worse. This laser is a very, very good laser as well. It's called a rev light. So we use it in the 1064 setting, low fluence we call it, and it works really well. So that combined with sunscreen, combined with your hydroquinone, works really well. I also sometimes use a tablet called tranexamic acid, and that can work for a certain type of melasma. So that's advanced stuff. Let your dermatologist guide you in regards to the prescription of that particular acid. Now, what other ways can we treat melasma? Let's go to another room and I'll show you. So welcome to the peel room. So melasma can also be treated with a variety of chemical peels and everything from glycolic acid. So let's go through the basics of melasma and peeling. So what kind of peels I like to use for melasma? Gentle peels. So I like to use glycolic acid, starting off with a 20%, then going all the way up to 50, even 70% for resistant melasma. The salicylic acid or BHA peels work? Well, they can, but they're not as good as AHAs. So basically I like my glycolics, lactics, but one of my favorites, TCA peels. So I love using a TCA peel, but it's a very low concentration. In the past, 10 years ago, I used to do 30-35% TCA peels. That's before we understood the etiology of how melasma actually behaves. So in the past, I used to use a high strength TCA. Nowadays, I use a very low strength TCA. So somewhere between 8 to 10%, basically a peel every 2 to 3 weeks. That combined with the hydroquinone and the sunscreen, and that can certainly help melasma. Is it as good as the Q-switch lasers? Personally, I don't think so, but can it be used? Absolutely.
So this is my protocol for treating melasma.
I'm using a Q-switch laser. The paradox of this laser is this. If you use this laser on something like paint, watch this. So watch this. Watch what it does on the paint. Look at that. It actually strips paint. Oh, we're going to have this wall repainted, so I won't be in trouble anyway. But that's stripping paint. You can see that. Once it hit my hand, I can't feel anything at all. So this is the laser we use to actually treat melasma. It's a very, very gentle laser. So this is how we do it. We're using it in what's known as a low fluence mode. So we're just passing all the way around there. I'm not hitting the eyebrow at all. I'm missing everything there. And just painting it. And what's the paint like?
Prickly feeling.
So it's a prickly feeling. That's all we're after. So we're treating that bit's done, and we're treating just under her eyes. So basically, my protocol is to do this every 2 weeks. Very, very gentle treatments. We can do a crisscross technique like this, and then crisscross back again. But we don't. The end point that we're after is just a little bit of redness. So this is a very, very, very gentle laser. I'm putting my hand over the eyebrow there, so I'm not actually treating that. And you can see, even if I hit my hand, the pain virtually is zero. So guys, there you have it. That's how you treat melasma. So let's have a look at a couple of before and after photos, some realistic outcomes. So remember, these are not my best photos which I pick up. These are just photos of normal people who've had melasma treatment, and this is how they should respond. So thanks for watching.
This is the most widely used before shot and should never be shown. This was used by Fraxel, as in Fraxel Laser Company. Do I like using certain Fraxels? Yes, I do, but this should never be used for melasma. These are more realistic expectations using a Q-switch laser together with hydroquinone before and after 10 weeks later. This is another case, once again using hydroquinone as a bleaching agent together with gentle laser treatments together with sunscreen before and afters. All predictable, all realistic. Now this photograph was taken over a decade ago. That is when I used the high strength TCA 35% peel before and after. I don't use this anymore due to the fact of rebound. Okay, next we have a lady who had melasma worsened by IPL. I treated her using my protocol, and there she is 10 weeks later, markedly improved. Now, what other methods can I use? I like using pico lasers, especially in ethnic skin types. This is before and after. The advantage of a pico laser is that instead of having 5 to 10 treatments, I can achieve the same result in about 3 to 4. Marked improvement both melasma together with the skin texture and tone in only 3 sessions. There's no downtime, but look at the improvement of the wrinkles as well. Here we are treating a little bit of melasma, but also some sun damage in ethnic skin types. Once again using a pico laser, in this case a pico Shure laser, and you can see the marked improvement in pigmentation.
So guys, thanks for watching this channel, and thanks for watching an educational section on treating melasma. So take home message: number 1, sunscreen; number 2, avoid IPL, avoid harsh treatments, be patient, and above all, make sure you use your sunscreen, your hats, and stay sun safe. If your melasma comes back, don't be disappointed, because every good dermatologist should have a melasma contingency plan. In other words, a prevention plan, not just a treatment plan. So most dermatologists have their own method. This is just how I treat melasma. Thanks again for watching, and subscribe if you like more information on lasers. Bye.
For those of you who are new to this channel, I basically do reviews on lasers, on laser procedures, what works, what doesn't work, and I also now am reviewing products now and then. So it's a fun educational channel which cuts through all the BS out there and tells it as it is. I'm also on Instagram, and I post a couple of fun pics every couple of days, so you will learn something from Instagram as well throughout the week. Thanks for that, guys. Bye.